Let's talk about things that can cause facial redness. These include things like rosacea, which is probably the most common cause of redness on the face. Other dermatologic conditions include things like seborrheic dermatitis and perioral dermatitis, allergic contact dermatitis from products that you use on your skin or from makeup. You can also get what's called a photosensitivity reaction or a rash from the sun, rashes from taking certain medications or supplements. Also just get flushing from increased heat or stress or exercise. And then there's some other types of skin conditions like eczema or psoriasis that just cause some annoying redness. Certain autoimmune conditions like lupus can also cause redness on the face. Let's talk about rosacea, which is a pretty common cause of redness, usually in the central face, like the cheeks and the chin area. There's two common types of rosacea, the redness type called the erythrotelangiectatic type, and there's also the kind that has acne bumps associated with it, or papulopustular rosacea. People with rosacea tend to have more sensitive or reactive skin. Their blood vessels tend to react or dilate more readily to various stimuli. Stimuli include things like sun, heat, hot weather or cold weather, alcohol, spicy food, stress, alcohol, and exercise. Rosacea has also been found to be associated with reaction to Demodex mites, which are mites that live on our skin. It has also been linked to certain gastrointestinal issues like irritable bowel syndrome or IBS, as well as SIBO. Recent studies have shown a link between rosacea and imbalanced gut flora. Rosacea has also been linked to acid reflux.
When it comes to just basic skincare with rosacea, the main theme is just keeping things gentle. Gentle cleansers, gentle moisturizers, gentle sunscreens. I recommend mineral-based sunscreens over chemical sunscreens. Brands that I really like that have gentle cleansing ingredients are CeraVe, La Roche-Posay, Avène, and Aveeno, as well as their moisturizers. When it comes to over-the-counter anti-rosacea ingredients, things that I like are azelaic acid, and there's some good ones out there by The Ordinary, Paula's Choice. I also think that sulfur can be helpful. There are some over-the-counter products out there, like Amazon has some sulfur soaps, and then Vichy has one. It's the Normaderm SOS Acne Spot Corrector. This has like 10% sulfur along with like some glycolic acid and niacinamide. Niacinamide is another ingredient to look for. A lot of times you can find it in moisturizers, like CeraVe has it in their moisturizers, but you can also, look for products that have higher concentrations of niacinamide. I like ones from Paula's Choice. SkinCeuticals has one called Metacell Renewal, which is like a nice nourishing moisturizer. And then there's some other ingredients that you can look for in like redness relief moisturizers. Things like licorice can actually really help with relieving redness, and you can find that in like the Cetaphil and Eucerin redness relief cream. So there's another ingredient called Feverfew, which you can find in the Aveeno Ultra Calming line. Even things like colloidal oatmeal can be soothing too, and Aveeno has a nice oatmeal line as well. Then you also want to make sure that you're avoiding triggers for rosacea. These can include things that make your vessels dilate, so heat, stress, exercise, alcohol, spicy foods, hot beverages. In some people, things like citrus fruits, chocolate, tomatoes can actually aggravate rosacea. And something that I also find interesting, and we're seeing more studies and research coming out for this, is a correlation with rosacea and internal gut health. We see a high rate of H. pylori or Helicobacter pylori. This is the bacteria that's responsible for acid reflux. We see higher rates of H. pylori in people with rosacea. We also see higher rates of IBS or irritable bowel syndrome, as well as something called SIBO or small intestinal bacterial overgrowth. So really looking at gut health and the balance of the microbiome is something that I think is going to be the future with rosacea treatment. When it comes to conventional treatment, like at the dermatologist's office, ingredients that I often use are things like metronidazole, ivermectin, higher strengths of azelaic acid. There's also an awesome ingredient called oxymetazoline that can actually constrict your blood vessels. It's kind of like Visine, but for the skin. If you want to do an over-the-counter hack version of that, some people can use Afrin spray, and sometimes you can mix it with like a nice gentle moisturizer, like a CeraVe moisturizer, and use that to relieve some redness. And then if your rosacea is severe, if you have a lot of acne rosacea, then we will do certain oral medicines like oral doxycycline. And then for really persistent or stubborn redness, we'll use laser treatment.
Prescriptions for rosacea include things like metronidazole gel, prescription strength azelaic acid, topical ivermectin, prescription strength sulfur washes or sulfur lotions. For more involved cases, we will prescribe certain antibiotics that have more anti-redness or anti-inflammatory properties like doxycycline. There are also certain topical prescription medicines that can constrict the blood vessels. For cases of really persistent or really resistant redness on the face, laser treatment can be very beneficial.
Can I talk my shit again? Talk my shit again.
Yes, there are some great medicines for rosacea out there, including azelaic acid. So this person used the 15% strength, which I do find works better than the over-the-counter 10% azelaic acid. But if you don't have access to a derm, you can certainly start with the 10% azelaic acid. But honestly, I think it's so easy these days to get access to online derm services. And there are other prescription options for rosacea that are also quite helpful. And remember, the theme with rosacea, you want to keep things gentle, gentle cleansers, gentle moisturizers. You want to build that skin barrier. And you also want to avoid triggers like excess heat, sun, alcohol, stress, spicy foods, basically things that can make your vessels dilate.